Hello and welcome to yet another master session on making health matter. This is an open knowledge initiative from Ogilvy, India. Today, we will take up the topic of Ayurveda. However, rather than talk about Ayurveda the way we kind of know about it, today we'll try to figure out if there are aspects of Ayurveda which is unknown to us. And there are a lot of interesting things about Ayurveda, at least unknown to me. And because there are so very many things, we will break down this session into multiple episodes. And for sharing the knowledge on Ayurveda and the interesting things on Ayurveda, we have with us a very esteemed guest today, Dr. C.K. Katiyar. If I was to introduce Dr. C.K. Katiyar through his entire resume, it'll take me a full episode. So I'm going to use a cut of his resume to introduce him. Dr. Chandrakant Katiyar is the CEO Technical with Emami Ltd. He's also the president of the International Association for Study of Traditional Asian Medicines, the India chapter. He's again the president of the Society for New Age Herbals, and he's also the vice president of the Society for Ethnopharmacology in India. Dr. Katiyar has more than 30 years of experience in research and development, scanning Ayurvedic medicines, nutraceuticals, and pharmaceuticals. Before Emami, Dr. Katiyar was the head of research and development at Dabur. Here, he developed several products, including paclitaxel, which is for ovarian cancer, and sumatriptan, which is for migraine. Dr. Katiyar is the member of DTAB, which is the Drugs Technical Advisory Board, the Ministry of Ayush. He is also on the governing body of a lot of institutes. Dr. Katiyar is on the editorial boards of journals. He's authored 5 books in Ayurveda and has received several awards for his contribution to the field of R&D in healthcare. Welcome, Dr. C.K. Katiyar, and thank you so much for doing this session with us.
Dear Mr. Rana, thank you very much for giving me opportunity. As you know, Ayurveda is my passion, and I believe that Ayurveda has much more interesting things than what people know. And during the session, I would like to show you only a glimpse of why I am saying what I am saying. Ayurveda is, besides what you know, much more than that.
I'm sure it is. I'm sure it is. Dr. Saab, that is fantastic. So I will dive directly into certain sets of questions with you, Dr. Saab. My first question is going to be on research. If one thinks about Ayurveda, the very first thing it comes to mind is its ancient wisdom. So what is this? Isn't this a kind of at odds when we talk about ancient wisdom and we talk about research? How do the two come together?
That's a very interesting question, and as I told you again, it is very little known aspect of Ayurveda. Ayurveda literally means knowledge of life or science of life. It has evolved through extensive research of thousands of years, actually speaking. In fact, the most ancient book of Ayurveda, Charak Samhita, which was written almost 3000 years ago, it starts from a conference of more than 50 sages to discuss issues of health of human beings. Such conferences were very common about 3000 years ago, and deliberations were chaired by one of the most enlightened person, like today's scientific seminars where there is one chairman, one moderator, and somebody writes the thing like that.
Sure.
And before documentation or written tradition, Ayurveda has undergone 4 essential steps of rigorous examination and evaluation. You can call it research also. What are they? One is Anuman, second is Pratyaksh, third is Praman, and fourth is Aptopadesh. These 4. What does it mean? Anuman means guess by observation. For example, appearance of smoke indicates presence of fire.
Right.
Second is Pratyaksha. If it is fire, then somebody actually goes and directly observes, yes, there is a fire.
Right.
And somebody physically sees that smoke is actually coming from the location and source of fire. This
Right.
leads to the evidence or what is called praman or evidence. that there is smoke. So now they will say, where there is smoke, there is fire. And once these are settled, then comes Aptopadesh, the final word. It gets its place in Ayurvedic lexicons only after passing these four essential stages. Unfortunately, a lot of people are not aware of this process, and that is why they doubt its robustness out of ignorance. Once several sages from throughout India congregated at one place and
Right.
shared their experiences, then it became the word of wisdom and became eligible to enter the ancient text. It is probably due to this robust process of observational research spanning over centuries that there are no recorded medical U-turns in Ayurveda.
Wow.
While in case of modern medicine, there are many.
Hmm.
However, since a lot of water has flown down the rivers, soil, weather, physique, lifestyles all have changed
Right.
during thousands of years. Then what was mentioned in those times may not be valid today. Therefore, there is need for validation of Ayurvedic principles and products by
Right.
today's contemporary research. So,
Hmm.
what was said was also research based. However, since thousands of years have passed, things have changed. Certainly, there is some kind of validation required, but this validation may not be exactly on the same parameter dictated by modern science.
Right. Right. Right.
Right. So that's my view. And coming to the efforts, I will say that Government of India has established Central Council for Research in Ayurveda Siddha in 1970 or 71, followed by establishment of similar council for Unani and homeopathy for the same purpose. As on today, lot of research is happening, not only these councils but also institutions of excellence like Banaras Hindu University, Gujarat Ayurveda University, Jamnagar, or India Institute of Ayurveda, New Delhi. This is Ayurvedic Institute. Besides that, other institutions like Indian Institute of Science, Bengaluru, All India Institute of Medical Sciences, New Delhi, NIPER, Mohali, etc. Lot of institutions are currently involved in academic research on Ayurvedic products or processes. Now, Ayurvedic products do undergo preclinical, including toxicity and pharmacological studies also. Besides clinical trials, as per the regulatory requirement, mandatory under the Drugs and Cosmetics Act. Chapter 4A before granting licenses. So it is wrong that Ayurvedic medicines are given license just as such without any studies. However, as Dr. Mashelkar said about a decade ago, in case of modern medicine, the research to be conducted should be on mouse to man approach. But in case of Ayurveda, it
Hmm.
should be meant to mouse approach, just reverse. It is also called reverse pharmacology. Therefore, while the research is ongoing process, the approach of research for Ayurveda needs to be appropriately defined, adapted, and followed as one size does not fit all. That's what my answer to your first set of questions.
Right. It is interesting, Doctor, that you've talked it in two aspects. One is about the fact that there was research was already always happening, but those times were different. So the methodology of research was along those times. And Ayurveda has kind of adapted and adopted the new processes of post the medicalization of science. The more thing that is evident today, whatever is being followed by the other sciences is also being followed by Ayurveda. That's very interesting. Dr. Saab, as a segue of this is that in the event so much of research is happening, what is the area of research in Ayurveda in the last maybe couple of decades or going forward right
Okay.
now? What is the focus on?
So I will share as the result of research in the last 3 to 4 decades.
Okay.
Certain categories or therapeutic areas have become totally dominated by Ayurvedic products.
Okay.
What are these? For example, menstrual cycle disorders in women,
Okay.
liver problems,
Mm-hmm.
digestion related problems,
Mm-hmm.
memory enhancers,
Mm-hmm.
anti stress product,
Mm-hmm.
chronic joint pain products, all the chronic lifestyle related diseases,
Mm-hmm.
even the things like galactogogues to enhance breast milk secretion, and today most commonly used the immunity. All
Mm-hmm.
these are the strength areas of Ayurveda based upon the researches. This has been possible only because of the researches conducted either by the research and academic institutions or by the industry. Talking about the important research based products, For example, if you wish to know, ashwagandha is internationally known product from India now for anti-stress, and its initial research was conducted at Banaras Hindu University.
Mm-hmm.
Giloy as immunomodulator, which created data wave during pandemic, was researched initially by KEM Hospital in Mumbai by Dr. Dhanukar.
Mm-hmm.
Brahmi as memory enhancer, Putki for liver, Gugulu to liver cholesterol as research contributions from the CSIR, Central Drug Research Institute, Lucknow.
Mm-hmm.
Bophilia for joint pain is the contribution of its CSIR, Indian Institute of Integrative Medicine, Jammu. And these are the ingredients, but a very few ingredients I'm telling you. These are the globally known and one of the top 50 selling extracts throughout the world from India, besides being used in Indian condition. If you look at the research-based repositioning, this was the products. If you
Mm-hmm.
look at the repositioning, ancient classical products of Ayurveda like Chavanprash
Mm-hmm.
was positioned from earlier family tonic to
Right.
immunomodulator. It was
Correct.
based on the thorough research. Ashoka Rist is a generic product which was positioned for dysmenorrhea, basis the research. If you look at the proprietary products, a story will remain incomplete without mentioning products like Live 52 for liver, Satavarex for boosting milk secretion for women, or even recently IU 64 as add-on therapy during COVID pandemic by the Ministry of Ayush.
Mm-hmm.
Besides all this, one very important research happened at Banaras Hindu University long ago on application of ancient surgical technique of Ayurveda called Chara Sutra for anorectal diseases like piles, fissure, and fistula. You will
Right.
be surprised to know that anorectal disease treatment of Ayurveda has developed as a super specialty in itself, leading to multiple hospitals dedicated to this specialty in Gujarat, in Maharashtra. You will find 50-bedded hospitals where only anorectal diseases with Shar Sutra has been treated. Thus, spectrum of research in Ayurveda is quite wide and
Right.
covers efficacy,
Mm-hmm.
safety, and quality of products, which are also recommended by WHO if we talk in terms of research in today's contemporary language.
When we talk about personalized medicine, today there's a whole lot of conversation about personalized medicine. And allopathy is trying to go down that line. However, when one hears about Ayurveda, one says Ayurveda always supported the idea of personalized medicine because it was always about treating the person rather than just treating the problem. What, according to you, is the way Ayurveda approaches personalized medicine? Why don't you share that point of view with us?
Rana, you asked a very interesting question. And I always say that there is a puzzle. Why some people respond to the drugs and food differently?
Uh-huh.
Somebody gains weight by consuming sweets, like me, others do not. Somebody becomes allergic to certain drugs, others do not. Answer to this puzzle lies in Ayurveda. As per Ayurveda, everybody is born with a particular prakriti or psychosomatic constitution, which takes into account a specific body and mind attributes, both.
Right.
Prakriti of two types is
Mm-hmm.
of two types, Janmaj by birth and Karmaj which is acquired. Two types.
Okay.
Birth Prakriti means by birth continues to grow and dictate the physiology and actions throughout the life. They
Right.
are predominantly three in number, Vata, Pitta and Kapha, and
Right.
total population can be divided in 10 different types of Prakriti including Vata, Pitta and Kapha, and there are 7 permutations and combinations.
Mm-hmm.
As we all know, Ayurveda has been practicing what you call discussed just now, personalized medicine since beginning, much before discovery of gene, to explain why every individual is different from others.
Right.
Basis of this personalized approach was Pitta and Kapha, which can be loosely translated into English as biological energy or biological forces. Vata is responsible for all kinds of movements, be it physical movement or movement of blood inside the body, or the movement of food from mouth to intestine, or the movement of sensory perception from skin to brain, even the movement of the thoughts, all is governed by the vata. Pitta is responsible for all kinds of metabolism or energy, be it digestive fire, indigestion, or the stomach, or at the cellular level individually.
Right.
Kapha is responsible for structural integrity of the body. Ayurveda has provided individual attributes for all these three main prakritis which can be identified from questionnaires which are available on the internet. If you see lot of them, you will find out. However, to
Right.
give a glimpse to you,
Hanji.
to Vata, Pitta, and Kapha personalities are for your convenience. Vata people are mostly lean and thin. They have dry skin, and you can write on their skin.
Okay.
They take a decisions very quickly, but keep on changing them. Very
Mm,
fluctuating in thoughts. They are very unstable in thoughts, are prone to any conditions for pain, including arthritis. But they are highly creative. They love travel and they are art lovers, highly imaginative.
interesting.
These people may take 3 to 4 glasses of water in a day, but
Mhm.
in small amounts at a time. Similarly, instead of taking heavy meal at one time, they prefer to have multiple meals in a smaller
Yeah.
quantity.
On.
These people do not have tendency of weight gain at all. Whatever amount of fat or sweet they may consume,
Right.
they will never gain weight.
Uh-huh.
And they love multitasking. That is
Okay.
the Vata kind of personality. Second is Pitta style. They are highly intelligent,
Okay.
very aggressive in behavior.
Mhm.
They make they may take more than 20 glasses of water in a day. Vata was taking 4, they take minimum 20 glasses of water. They are voracious eaters and love spicy food. They usually have fair complexion, always chasing the target and have tendency to win. And they go into depression if their target is not met. They are
Ah,
very, yes, yes, they go into depression. And they
interesting.
are very prone to stress, hyperacidity, and peptic ulcer.
Mhm.
On the just opposite is the Kapha people.
Ah,
Basically, they have a heavy body frame and
mhm.
lazy inactions.
Mm.
They love sleep for longer hours and try to keep away from physical exercises and prefer to lead sedentary life.
Okay.
They
Okay.
have they neither do morning walk nor do they evening walk. They don't love to walk.
Okay.
They have very high tendency of weight gain. They hardly take 2 to 3 glasses of water in a day. Their
Mm.
skin is always moistened. They
Okay.
are slow in taking decision, but
Right.
once they take, they stick to it, come what may. They are slow not only in movement but also in thoughts. They are uh, they do only one thing at a time, and they
Mm.
are very prone to have metabolic conditions like diabetes.
Okay.
But
Okay.
but only 10% of people have single prakriti. Most of them have dual prakriti,
Right.
with one is dominating the other.
Right.
In such cases, dominating prakriti should be taken into account.
Okay.
Now, one more thing, Vata, Pitta, and Kapha also affect different phases of life. Like childhood is dominated by Kapha. That is why children have running nose and have very soft skin. Adulthood is mostly dominated by Pitta, and old age is mostly dominated by Vata. Even Kapha Prakriti person will start showing symptoms of Vata like dry skin
Right.
and the wrinkles on the skin when he approaches old age. Ayurveda has recommended specific lifestyles, including daily and seasonal routines for individual Prakriti type people. It also includes details like suitable vegetables or fruits, everything. Concept of Prakriti is a unique contribution of Ayurveda.
Mhm.
Currently, lot of interdisciplinary researches are going on involving genetics and biochemistry to deep dive into the Prakriti concept of Ayurveda.
Right.
Identification of Prakriti can be a very good tool of predicting diseases and framing the health policy by the nations later on.
Mm.
Few scientists in countries like Russia are working on a wearable medical device to
Oh.
support identification of Prakriti coupled with few questions. So it will be watch. You wear this watch here,
Right.
and you answer 4 questions, and computer will tell you what is your Prakriti and what is good for you, what lifestyle is ideal for you. Everything it will tell you. It is at the experimental stage right now. and maybe within a year that it is. I am talking in Russia. One such similar thing happening in US also, in India also. Experiments are going on
Okay.
because what was called Nadi Vaidya, if you remember, there were
Yes.
Vaidya who were looking Nadi. Now
And
those Vaidya no more be required. You just wear a watch. This watch itself will tell you your prakriti, and it will work like a jyotishi for you in terms of healthcare. So that's a unique contribution. So that's a personalized medicine started by Ayurveda long ago. Now it is ending up into a such kind of beautiful genetic based research tools.
very interesting, Dr. Saab. In fact, now that you mention, sometime earlier, somebody had, this is Nadi Pariksha, if I,
Yeah, Nadi Pariksha, yeah, right.
and I know of somebody who's trying to develop a kind of a medical device in India also. So this
Yeah.
is interesting. Though there are, I guess there will be time. It'll be a while before we can train the machine to think and do exactly what the Ayurveds would do. But this is very interesting. Thanks for sharing that. So, Dr.
Yeah.
Saab, I will now talk about the third aspect. In fact, you've already, alluded to a very interesting thing of saying that one of the aspects of personalization is not just the medication, but also the other two things, which is about the diet that a person takes.
Right.
So, from a food standpoint, you've outlined personalities. Is there a point of view that Ayurveda has from the intake of food in itself, or
Um,
you want to call it that way?
yes, you. For food also, Charak Samhita recommends objective of Ayurveda as Swasthasya Swasthya Rakshanam Athurasya Vikara Prashamanam, means maintain the health of the healthy body of healthy person and cure if somebody falls ill.
Right,
And that for that, Ayurveda has recommended Prakriti specific lifestyle to lead 100 years of active life. They recommended a tripod of life. What tripod? It is ahar, that is food, nidra, that is sleep, and brahmacharya, that is controlled reproductive activities.
right,
And these three are the very important tools for anybody, even today, you see, to live longer. As per Ayurveda, food is essential for life, energy, growth, strength, intellect,
hmm,
happiness, and cognition, memory.
right,
Food after digestion undergoes
right,
biochemical changes and
right,
gets converted to rasa, which is lymph, rakta, which
right,
is blood,
right,
mans, which is muscle,
right,
meda, which is fat, asti, which is bone, majja, which is bone marrow, and at the end, sukra, which is reproductive entity, which can be sperm or ovum, and
right,
at the end, ojas, which is called essential energy for body and mind.
right.
Keeping in view its importance, Charak Samhita, almost 3000 years ago, devoted chapters after chapters on food, on what is balanced food, which food is suitable for whom, how to prepare it, factors influencing the diet, how to serve it, who should serve it, how to take it, etc. Going into details of every aspect.
Right.
Ayurveda has recommended nature, processing, combination,
Mhm.
quantity, place, time, and rule for consumers, besides the factor which influence the effects of the food on the body. It has also mentioned sources like animals, vegetables, milk products, honey, etc., as components of food, including spices.
Right.
Ayurveda has been totally neutral on vegetarian or non-vegetarian food.
Oh,
Neither recommends this. So it says where you are born, whatever is the normal food habit, just
mhm.
follow that. Right?
Interesting. Very
Yeah.
interesting.
Its principle is very simple. Your food should depend on where you are born and what are the vegetables or fruits or animals available in your locality, in the habitat.
Eh,
Like exercise, rules of Ati Yoga, Hini Yoga, Mithya Yoga, and Samyak Yoga apply on food. So what is Ati Yoga means excessive use, Hini Yoga means less use, Mithya Yoga means improper use, Samyak Yoga means proper use. These things. It only four types can happen. In case of food, Ayurveda has beautifully described the science of appropriate food, what you have taken. You will
mhm.
not find this discussion anywhere else. Ayurveda says that food quantity is appropriate, after consuming which hunger gets subsided and there is no inconvenience in standing, sitting, lying down, moving,
Mhm.
respiration, laughing, and gossiping. Besides, there should be no heaviness in the stomach. When you are having all this, then only your food is appropriate. Otherwise, either it is less or it is more.
This is so
You do
interesting.
description, right?
So
There is,
interesting.
yeah, there is one more important description.
And
And even when balanced food may become the when what are the conditions where even balanced food may become the cause of disease.
right.
Always says balanced food will lead to indigestion if it is consumed during the situations of stress,
Oh
anxiety, grief, fear, anger, and sleeplessness. Does this ring the bell?
my
Just,
God.
just look at the common lifestyles of the people who are working in call centers today,
So right. You're so
right?
right.
So all, even the food is very, we say, no, I am taking very good amount of protein, fat, and carbohydrate, everything balanced. Despite that, why it's happening to me, my dear? This is why it is happening to you.
This is so incredible, Doctor Saab, कि आपने, the first thing you mentioned was about the fact that right from old ages, the people have been saying consume just the food that you need, not the food that you want to eat.
Yeah, right.
That is one part. But I think very interestingly, you just talked about the fact that how much of us when we refer to emotional eating, you virtually talked about the fact that under so very many emotions we
Yeah.
consume. And what I'm hearing you say is when you consume under the emotional garb, the food tends to not benefit you, but actually becomes a problem for you.
And one more thing, besides multiple other recommendations, I will also recommend very important thing. One should take water only after 2 hours of taking the food.
Right,
This is very simple to understand.
right,
Hydrochloric acid inside the stomach is responsible for digestion.
right,
If we take water immediately after the food, it will get diluted,
right.
which will lead to heaviness in the stomach and delay in digestion.
Digestion, correct,
Right?
correct.
So that is why I will recommend always take, and you could practice today. If you take water after 2 hours of food, you will feel much lighter. Right?
Uh,
So that is probably, if you follow all the proper rules recommended by Ayurveda, which was Ahar is one of the tripod of life to lead 100 years of active life. That is the reason why it was said, let food be thy medicine. That was the proverb written long back.
Also,
Yeah.
that is a fantastic understanding and appreciation on the food side. Uh, what one will do is now I'm sure when you talk about the tripod, the aspect of exercise actually comes up. And
Sure, sure.
again, back to anything which is chronic, even allopathy talks about DEM, which is diet, exercise, and medication. We've
Right.
kind of covered two sides of it, or the aspect of diet. What's the point of view that Ayurveda has on exercise? Does it prescribe a certain type, a way, time on exercise?
I think, Mr. Rana, you have asked my this very appropriate question, and the timing could not be more appropriate. And everybody is going to gym, whether you need it or not,
Anji,
right?
Anji,
Everybody cannot be a fighter. Everybody cannot be a person going for the, but still you are going to gym,
correct.
right? As I told you, Ayurveda believes that all the activities of the body can be of four types, as I told you. Ati Yog, Hin Yog, Mithya Yog, or Samyak Yog. Ati Yog means excessive use. Hin Yog means lesser use. Mithya Yog means improper use. And Samyak Yog means proper use.
Right.
The same is true for all activities, including exercise.
Mm-hmm.
The concept of Ayurveda on exercise is very different from the one which is being currently witnessed these days. Where
Right.
a lot of people are going to gym, are
Mm-hmm.
doing brisk morning and evening walk, are
Mm-hmm.
walking on the treadmill, etc.
Okay.
Today, if somebody tells you to recommend,
Mm-hmm.
walk 3 kilometers, brisk walk in 30 minutes to remain healthy.
Mm-hmm.
Ayurveda recommends entirely different.
Okay.
For example, Ayurveda said it is Atyog. If you do it, it is Atyog, excessive use. As per Ayurveda, objective of exercise is to enhance the stamina of the body.
Right.
The optimum amount, the Samyak Yoga of exercise the is the perspiration. Perspiration means small droplets appearing on the forehead one
Right.
step before sweating.
Right.
Right? The
Right.
moment you stop having perspiration, stop. Take rest.
Okay.
Do it again. Suppose on day one, it takes you 10 minutes to start to have perspiration.
Right.
Next day, it will take 12 minutes. Third day,
Right.
it will take 15 minutes. Slowly, you will enhance the stamina of the body for perspiration, but never cross the limit of perspiration. I know one of few senior people who collapsed during treadmill exercise
Yes.
because they kept cleaning on the sweat from the face with a
Yes.
towel and
Yes.
continued running and ultimately collapsed. These are the mistakes we should learn from. We need to remember that Ayurveda is science of life and not a system of medicine. It has been hidden secret for leading healthy and active life which are not yet in public domain.
Right. Right.
Ayurveda provides recommendations on each aspect of life with the objective of how to live 100 years of life. We need to create awareness of these little but unknown but important facets of Ayurveda to harness its benefits throughout the life. Exercise we discussed, and like that, food also we discussed, right? So I will recommend all of you who are doing exercises, please do not carry towel with you for exercise. Because if you need towel, you are doing at yoga. You are doing excessive use. Stop.
My God, that is such an interesting point of view. And I love what you said at the very end, that in the event you're carrying it, you're doing it wrong. That's a
Yeah, right.
thank you, Dr. Sab. Thank you so much for sharing this bit. My last point is the one which has created, I guess, the maximum amount of controversy.
Ah,
Every time one discusses about Ayurveda versus allopathy versus homeopathy versus the other pathy, and the fact that anybody who looks at it, who looks at any of these traditional medicines or
yeah.
traditional sciences through the lens of allopathy always labels it. So you have the entire, the pathis talking about and talking against each other. How do you see Ayurveda versus allopathy? Is it a competition? Is this about collectiveness? How do you see this?
Mr. Rana, it's a very appropriate question at a right time when government of India is now trying for one nation, one health approach.
Right.
And we have seen some uh, very altered responses the last few months.
Sure.
I find lot of ignorance among the professionals from both the studies
Right.
when talking about conflict between Ayurveda and allopathy.
Okay.
Charak Samhita has recommended to adopt anything which is new
Mhm.
in different times.
Right.
So large-hearted. Therefore, I personally do not see any competition in Ayurveda and allopathy. Rather, I see lot of scope of complementing the strengths of each other.
Interesting.
To cite few real life examples, we all know that when our children fall sick, we normally prefer homeopathy over allopathy.
Right. Right. Right.
Maybe as a male member, you would like to go to allopathy, but your wife will say, no, let us take to
Correct.
homeopathy.
Correct.
Right? So that's one. During acute conditions like severe infections or heart attack, it is only allopathy which can treat it.
That is
However,
so.
however, when it comes to chronic lifestyle disorders like arthritis, indigestion, constipation, and complications of certain diseases,
Uh-huh.
Ayurveda is the preferred option. So personally, I do not see any competition. Rather, I see lot of strength in both of them coming together for the benefit of the human being. To cite few more examples, I was involved in a clinical trial on terminally Arjuna, bark of Arjuna tree in
Mm.
congestive heart failure with Professor Maulik at All India Institute of Medical Sciences, New Delhi. We were supposed to recruit only 100 patients of chronic heart disease at AIMS with criteria that patients should not be taking Arjuna on their own.
Right.
To our surprise, we came to know that most of the patients were already consuming Arjuna on their own, and it took us about 1 year to recruit that one small number of patients at a center like AIMS. The point I wanted to convey is that when a patient comes back home from ICU due to heart attack, he starts taking Arjuna, which has good reputation of being cardioprotective to prevent occurrence of another heart attack on his own. This is a perfect example of complementing the strengths of each other. While
Right.
acute condition was taken care of by allopathy, Ayurveda was used to prevent the recurrence of heart attack by patient himself. I see no reason why an allopathic doctor cannot prescribe it to such patients like low dose aspirin as a blood thinner. Similarly, you will hardly find a patient of diabetes in India who does not take neem, jamun, or karela on his own. There are multiple other examples like arthritis also, where combination therapy is almost routine. Issue
Right.
is why can we not consider integrating both of them to provide benefits of both the systems to the patients? Currently, government is working on One Nation One Health project. I have suggested a new model of integrated healthcare in an article on One Nation One Health. I have
Right.
suggested integration of 75% Ayush and 25% of modern medicine and primary healthcare in the villages and 50-50 at district hospital and 75% modern medicine and 25% Ayurveda at tertiary hospitals. But all of them under one roof.
Interesting.
In the last 2 to 3 years, we have witnessed multiple efforts by Government of India on integration of healthcare and very strong reaction from Indian Medical Association to this idea. I think it needs change of mindset by the members of IMA to face reality of poor healthcare infrastructure in India and the support concept of one integrative healthcare under the project One Nation One Health. That would be the most ideal. Therefore, I personally, at my level, I do not see any conflict. Rather, they can complement the strength of each other.
Right. Right. Right.
I hope it replies.
Oh yes, Dr. Saab, thank you so much for this. This was really eye-opening. More than the aspect of if I was to simply say that we were talking about interesting points about Ayurveda, there are so many bits in the way one looks at Ayurveda and so many myths that one actually has. It was interesting to dispel a lot of myths and actually get to know so very many new interesting facts about Ayurveda. Thank you so much for sharing your knowledge with us, Doctor. Thank you once again.
Thank you. Thank you, Mr. Rana, for giving me opportunity. And it will be my pleasure to talk you sometime in future on still unknown facts, facets of Ayurveda. Because, Ayurveda suggests it is better to commit suicide rather than going to a quack for treatment.
Wow, you've left this particular thing has been left.
So sometime we will discuss even 3,000 years ago there were quacks. It's not the problem of today only. It was that time also.
This is so interesting, Doctor. That becomes, as they say, at the end of an episode, when a person says, "Agle season में क्या होएगा?"
Right.
आपने Doctor, thank
Right.
you so much for doing this with us. Really appreciate it.
Thank, thank.